welcome to your 24-week visit education information. At this visit, we talk about a few different things, some of which are things to look out for at this time in pregnancy. Other things have to do with what is going to be coming next at your visit at around 28 weeks. So at the 28-week visit, we do a couple different blood tests usually. One of those is testing and screening for gestational diabetes. And why do we test for gestational diabetes? Well, in pregnancy, your body, of course, there are many different changes, and your hormones really can affect a lot of different organs or, just elements of your body. And the pancreas in particular is responsible for secreting something called insulin, which when you eat sugar, carbohydrates, just normally, your pancreas secretes insulin, and that helps you metabolize that sugar. Well, in pregnancy, sometimes those hormones can make your pancreas not secrete the insulin that it needs in order to metabolize the blood sugar the way that we want your body to do so. And so pregnant women are more likely to experience that than if you are not pregnant. So the reason being that we screen for people in pregnancy is that if someone does not secrete enough insulin for their body to metabolize the blood sugar, baby is then exposed to more sugar as a result. And so when they are born, if they have been exposed to that higher sugary environment, there can be some side effects like a larger baby, but also once they're disconnected from the umbilical cord, they can have actually the opposite effect where they can show a hypoglycemic reaction or a low blood sugar effect. And some of those side effects can be more severe for babies. And so we really feel strongly about making sure that women do not have gestational diabetes, particularly out of hospital, to make sure that we can have the safest environment for both moms and babies. So when you come into your 28-week visit, what happens is that you'll walk in and we'll give you have two different options to drink. One of them is a standard glucola drink that is just a very sugary beverage, and the other one is also a drink that Quest, our laboratory, has come up with organic version that has no dyes, and so some women choose to do that as well. But in either case, you'll come in and have 5 minutes to drink the drink, and then an hour later we do a blood draw to test your blood sugar of how your body metabolized that drink. I always tell people to don't fast before this first initial screen. Just have a normal wake up, protein breakfast, whatever that looks like, and then come on in and we'll do that. If this screen ends up being high, it is a screen. So we would have women come back to do a 3-hour diagnostic test. And at that time, if that result was high, someone would actually be diagnosed with gestational diabetes. I do tell people that doesn't necessarily risk you out of being here at the birth center. If your blood sugars can be managed by diet and exercise, then women will still deliver here at the birth center. And if we do need to explore having medicine like insulin or metformin at that time, then that's when we would seek other care. But we will cross that bridge much later down the road if we would need to do that. So just to expect at that visit that you would come in and do that screen. We also like to test your iron levels at this time to get a feel for how those are doing in pregnancy. It's normal that as your circulation is increasing, your iron is going to be dropping, and at this time we like to get a feel for where is your hemoglobin or your iron at. And so when we test this, we oftentimes will recommend that women supplement depending on what that level is, because obviously as you go into later pregnancy and end up giving birth, you are going to lose some blood, and as a result have your iron levels drop. And those lower iron levels can lead to things like lower milk supply, affect your mood, fatigue, and so we really like to boost those up as much as we can. So we like to get a check-in at where those are at that 28-week mark as well. Some other things we like to talk about at this time have to do with things to kind of look out for in pregnancy. So some of you may have already been experiencing maybe some contractions or cramping, tightening in your uterus, and so we like to talk about reasons to call us or what that might look like. So if your uterus is contracting, it usually will do so in a few different ways. If you're having what's called a Braxton Hicks contraction, which is oftentimes going to be tightening of your uterus and can sometimes last for a minute, multiple minutes, a longer period of time, it oftentimes is not going to be as rhythmic in nature as that of a labor contraction. So a labor contraction is going to be more often the case where your uterus tightens or contracts, cramps up, And then after a minute or so, it will loosen. And then a few minutes later, the same thing happens. And then it will loosen, and then again. If that's happening more than we say 6 times in an hour, or if you think about more frequently than every 10 minutes or so, we like you to call and check in. Especially if you've been trying to do some things where you stop doing what you're doing, you sit down, drink water, maybe take a bath, and those are still coming rhythmically, we want you to keep us posted. Because oftentimes you'll do those things and they start to space out. And so letting us know if you are experiencing those signs, we like to check in on that. And more often than not, most of the time, it's not preterm labor, but at least we can get a sense for what you're feeling and talk through different things that might be going on. The other piece of that, of course, is if you have any like big gush of fluid, or if you feel like you are leaking watery fluid from your vagina, then we want you to call us as well. Or if you're seeing vaginal bleeding, that would be another reason to call and check in with us too. At this point too, we also like to check in to see if families are interested in having a doula at their birth. We love working with doulas here at the Birth Center. The Twin Cities has an amazing birth community and amazing doulas, and so we have a lot of our families have a doula outside of us and bring in a doula from the community, and we love that. That's great. We also though have an intern program here at the Birth Center. This is for doulas that have gone through the training, but they're not yet certified based on that they need to do a certain amount of births to achieve that certification. And so for families, it's a $50 flat fee to use the program, and our doulas are found on the patient portal. And so you can log into that website and see on there their list of autobiographies to be able to get a sense for, some information on each one of them. And then you feel free to contact as many as you'd like, interview, and potentially choose someone to be at your birth. And I've worked here at the Birth Center for almost 6 years, and I have had great experience with the doula interns. They've been awesome. They usually tend to be in the program, give or take 3 months or so. So sometimes when people look a little bit too early on in pregnancy, the doulas maybe have graduated by the time your guest date will come around. So we usually say to look at the website somewhere between like the 28 and 30 week mark, sometimes earlier, just to start reaching out to find someone that can help best support you. If you have any questions about that information that I've covered on this video, please do not hesitate to contact the Birth Center. You can call our nurse line and we can talk through any of that information with you. Otherwise, I hope that you are doing well, and we will talk to you soon.